Keegan was here about, was that like 10 months ago? 9 months ago. And when he originally came, lots of primitive reflexes, lots of eye tracking issues, balance, coordination issues. And primary concern, correct me if I was wrong, was primarily behavioral stuff. But in that first intensive, we rehabbed a lot of that stuff. Focused on his primitive reflexes primarily. But just give us a rundown of kind of what's changed in the last 9 months of after leaving here, and now we're back again. But what's happened in between?
Yeah, so even before we left here, we had seen so many changes. I mean, he was eating differently. He was able to go to the playground without any behavioral incidents. We previously dealt with a lot of violence that disappeared, pretty much was gone for a majority of the time since being back from therapy.
Yeah.
So, the violence changed. He was able to interact socially a lot better. His school has been going better, so he's been learning to read, which we weren't able to do before.
Yeah.
He wasn't able to focus on math, so like he's actually able to learn in school.
Yeah, and I mean, when he came back, we retested his eyes. Just to give perspective, is he went from the 15th percentile to the 60th percentile. I mean, like he literally probably couldn't track a line with his eyes, which would be super stressful in itself. So
yeah.
It's huge.
Yeah, that was a major moment to see like the data on that.
Yeah.
Because it was like, I'm not crazy. He's actually doing school now. And
yeah.
So, that's a major, and we didn't work on anything. We didn't work on any of the stuff that would require him to improve in that area. He just existed without the primitive reflexes.
Yeah.
And his eyes improved. So.
Yeah, and that's what usually happens. Most of the time we get rid of the reflexes, and just through them moving appropriately and activating their brain in different ways, they usually stay integrated and get stronger. And that's what we found when we came back. The reflexes look great, so which is huge. What else has changed? What else has been different? Mood, obviously, I would assume has been a lot better, but anything else, big things you noticed after just having 9 months to develop?
Yeah, he was a lot more regulated. And before we came to therapy, we were like, does he have ADHD? We had doctors telling us maybe he has autism, and just different like diagnoses that everybody was trying to pin on him, but we never really felt like anything fit just right. And we could never tease apart all of the different things, because one day it would look like he had ADHD. Another day it would look like he had autism. Another day he would have, oppositional defiant disorder. It was just like everything was different. There was never anything that we could pin down that would work, that would help him. We tried behavioral therapy. We had people coming out to the house. I mean, all different things, and nothing ever stuck, nothing ever worked, nothing was ever predictable. But after we came back, we started to be able to see like the different things that were gone, and then the things that were left allowed us to see exactly what needed to be worked on, exactly what was related to the pandas, what was related to behavior, what was related to stuff that needed to happen in the brain. And we actually had a psychiatric evaluation that we had scheduled for when we got back. And I didn't tell you this, but they didn't know what to do with him because they couldn't see anything anymore that was like obvious.
Yeah.
Because we thought we would have to put him on medication. And so she was like, I don't know, we just have to watch him and see. And so since then, the only thing that's really left that we're working through is the anxiety piece of anything that they would have, evaluated him for, which that is also related to some other health things too.
Yeah,
so
for sure.
So we were able to like just see everything so much clearer because we unraveled so many things here.
Yeah.
And so that in itself is huge for us.
Yeah, and I truly believe like whether it's almost no matter what a kid comes in with, there's true like physiological underlying mechanisms that make a lot of sense for most of their symptoms, right? I mean, like there can be brain injuries and stuff like that play into it, but like most time with behavioral issues, maybe there's underdevelopment of some reflexes, maybe there's an autoimmune issue going on, maybe there's some infections going on, but there's always usually a reason if someone's willing to dig hard enough and run the right tests and figure that out, or just do a good physical exam in a lot of cases. And so I'm really excited we're able to make that happen for him and help him out there and start to paint a clear picture for him. So
yeah.
Thanks for doing this interview. Thanks for letting us capture a bunch of stuff on him, because this is going to help so many kids just get down the right track, to be honest.
Yeah. No, I really believe in what you guys are doing. I think that this is like cutting edge, and it's a little scary as a parent to like do something that's not popular and everybody else isn't doing it. It's not covered by insurance. You can't really pay for it except for out of your own pocket. But when you take that risk and you make the sacrifices for your kid, it changes everything. Like, it changes your whole family's life. And I hope and pray that other parents will start to see that and be able to make those sacrifices. And I hope funds become available for people, because it is really life-changing. And so we're really thankful for everything you guys have done.
Thank you. We're excited for him. He's such a good kid. I'm just excited to see that come out in a lot of different ways for him.
Yeah.
Cool. Well, thank you.